I now recognize Dr. Redfield to give an opening statement.
Chairman Winthrop, Ranking Member Reese, and members of the committee, I'm pleased to testify today in support of this subcommittee's important work to investigate the origin of COVID-19 that has resulted in the deaths of over 1 million Americans. From 2018 to 2021, I served as the 18th Director of the Centers for Disease Control and Prevention during the Trump administration. As CDC Director, I oversaw the agency's response to the COVID-19 pandemic from the earliest days of its spread, and I also served as a member of the White House Coronavirus Task Force. But perhaps more relevant for the purpose of this hearing, my 45 years in medicine have been focused on the study of viruses. I'm a virologist by training and by practice. Prior to my time at CDC, I spent more than 20 years as a U.S. Army physician and medical researcher at the Walter Reed Army Institute of Research, where I served as the chief of the Department of Retroviral Research, and I worked in virology, immunology, clinical research at the forefront of AIDS epidemic and other viral threats. In 1996, I co-founded the Institute of Human Virology at the University of Maryland in partnership with the state of Maryland, the city of Baltimore, and the University System of Maryland, where I served as the Director of Clinical Research and Care, and I also served as a tenured Professor of Medicine, Microbiology, and Immunology, Chief of Infectious Disease, and Vice Chair of Medicine at the university. After my time at CDC, I served as the Senior Public Health Advisor to Governor Hogan in the state of Maryland. As COVID-19 began to spread across the world, there were two competing hypotheses about the origin of this virus that needed to be vigorously explored. The first hypothesis is the possibility that COVID-19 infections in humans were the result of a spillover event from nature. This is a situation in which the virus naturally mutates and becomes more transmissible from one species to another, in this case from bats to humans via an intermediate species. This is what happened in previous outbreaks of SARS and MERS and earlier coronaviruses that emerged from bats and spread through an intermediate animal. The second hypothesis is the possibility that the virus evolved in a laboratory involved in gain-of-function research. This is a type of research in which scientists seek to increase the transmissibility or pathogenicity of an organism in order to better understand that organism and inform preparedness efforts and the development of countermeasures such as therapeutics and vaccines. Under this theory, COVID infected the general population after it was accidentally leaked from a lab in China. From the earliest days of the pandemic, my view was both theories about the origin needed to be aggressively and thoroughly examined. Based on my initial analysis of the data, I came to believe, and I still believe today, that it indicates that COVID-19 more likely was the result of an accidental lab leak than a result of a natural spillover event. This conclusion is based primarily on the biology of the virus itself, including the rapid high infectivity for human-to-human transmission, which would then predict the rapid evolution of new variants, as well as a number of other important factors, which also include the unusual actions in and around Wuhan in the fall of 2019, all of which I'm happy to discuss today. Even given the information that surfaced in the 3 years since the COVID-19 pandemic began, some have contended that there's really no point in investigating the origin of this virus. I strongly disagree. There is a global need to know what we are dealing with in COVID virus because it affects how we approach the problem to try to prevent the next pandemic. The understanding of the origin of COVID is critical to future science research, particularly as it affects ongoing ethical debate around gain-of-function research. Gain-of-function research has long been controversial within the scientific community. In my own opinion, COVID-19 pandemic presents a case study on the potential dangers of such research. While many believe that gain-of-function research is critical to get ahead of viruses by developing vaccines, in this case, I believe it was the exact opposite, unleashing a new virus to the world without any means of stopping it and resulting in the deaths of millions of people. Because of this, it's my opinion that we should call for a moratorium on gain-of-function research until we have a broader debate and we come to a consensus at a community about the value of gain-of-function research. This debate should not be limited to the scientific community. If the decision is to continue with gain-of-function research, then it must be determined how and where to conduct that research in a safe, responsible, and effective way. I thank you for inviting me here today. As we explore this important topic, I look forward to answering your questions. Thank you.
Dr. Redfield, are you an advocate for a moratorium on gain-of-function research, particularly research on potential pandemic pathogens, and why?
Yes, I am. I think that, again, I think the people that are advocates for gain-of-function research do believe that by doing this research, they somehow get ahead of the curve. I'm of the point of view that we don't need to make pathogens more transmissible or more pathogenic in order to get ahead of the curve. We can begin to deal with those pathogens as they evolve. I don't think this should be a decision made by scientists alone. This is a societal decision. There should be a broad debate about whether this research is really necessary. And if so, we should decide how to do it safely and responsibly. I remind people, when I was CDC director, one of the most difficult things I had to do as a 20-something-year Army vet was shut down Fort Detrick. It wasn't very popular. These people were my friends. I knew them. But our inspection showed that they were cutting corners in their biosecurity requirements. And I felt that we weren't going to take that chance with the Frederick community and beyond. And so I shut the lab down for 4 to 6 months until they corrected their biosecurity. So I think this is much more complicated than people think. And if we are to go down that path, I would argue there's a few labs in the world that should be with multiple redundancy in containment to do this. But I'm not convinced it's to an advantage, and this is why in the Wall Street Journal op-ed I did, I strongly recommend that we have a moratorium on gain-of-function research, similar to what we had in the Obama administration.
In one sentence, can you provide a definition of gain-of-function research? And I say that because there becomes a little semantics sometimes, I believe, within the scientific community of what is a chimera and what is gain of function.
Yeah, I think it's to take a pathogen and try to increase one of two things or both, to increase its transmissibility or its pathogenicity. I disagree with some of my colleagues at NIH to say the definition is restricted to a pathogen that's already a pathogen. If I make a non-pathogen pathogenic, that's gain of function.
So in your expert opinion, was the Wuhan Institute conducting gain-of-function research on coronaviruses? Thank you. So one other path of questioning for you, Dr. Redfield. Proponents of this research claim it may result in vaccines or maybe even stop a pandemic. Dr. Redfield, has gain-of-function created any life-saving vaccines or therapeutics to your knowledge?
Not to my knowledge.
Has gain-of-function stopped a pandemic, in your opinion?
No, on the contrary, I think it probably caused the greatest pandemic our world has seen.
Do you find any tangible benefits to gain-of-function research at this time?
I personally don't, but I do want to stress, I think the men and women that support it are people of good faith because they truly believe it's going to lead to a potential benefit. I disagree with that assessment.
I now recognize Ms. Maliotakis from New York for 5 minutes of questions.
Dr. Redfield, you pointed to the lab leak theory even before we did. In mid-January of 2020, you expressed concerns to Dr. Fauci, to Jeremy Farrar of UK's Wellcome Trust, and to Dr. Tedros of World Health Organization that, quote, we had to take the lab leak hypothesis with extreme seriousness. And you urged Dr. Fauci to investigate both the lab and the natural hypotheses. Shortly thereafter, on February 1st, Farrar convened a meeting of a group of 11 top scientists across 5 time zones and asked Dr. Fauci to join, and he wrote, quote, my preference is to keep this group really tight. Obviously, ask everyone to treat in total confidence, unquote. Dr. Redfield, you were excluded from this call, but up until then, you had been on you were included in every other conversation. What changed? Why do you think that you were excluded from these conversations?
Thank you very much. I think just to emphasize, in early to mid-January, I did have multiple calls with Fauci, Farrar, and Tedros about how important I thought it was that science get engaged in aggressively pursuing both hypotheses. I also expressed, as a clinical virologist, that I felt it was not scientifically plausible that this virus went from a bat to humans and became one of the most infectious viruses that we have for humans. All viruses are not the same. So when you look at coronaviruses, for SARS and MERS, for example, when they entered the human species, which they did via an intermediate, they never learned how to go human to human. Even to this day, they don't know how to go human to human. So you can't equate Ebola with a coronavirus.
Now, why do you think you were excluded from those calls?
Because it was told to me that they wanted a single narrative and that I obviously had a different point of view.
Okay. In emails following the conference call, 4 of the 11 scientists told Fauci that they all found the genetic sequence inconsistent with expectations from evolutionary theory, basically what you're saying. However, just 3 days later, these 4 scientists had drafted a paper arguing the exact opposite, and that's now the infamous proximal origin of SARS-CoV-2. Our investigations show that this paper was prompted by Dr. Fauci, among others, with a goal to disprove the lab leak theory. What is the likelihood that these scientists came across additional information just 3 days after making these statements to conclude with such certainty that COVID-19 came from nature instead of the lab leak that they thought it was 3 days earlier?
Yeah, I think it's unfortunate. Again, I've said this before, that this whole approach that was taken on February 1st, and subsequently in the month of February, if you really want to be truthful, it's antithetical to science.
Thank you.
Science has debate, and they squashed any debate.
Thank you. Given what we know now and looking at all the conversations in February of 2020 and before the release of the paper, do you think that Dr. Fauci used this paper to hide the gain-of-function research created this virus?
I can't talk about Fauci's motivation.
Do you think that the paper does hide the truth?
I think it's an inaccurate paper that basically was part of a narrative that they were creating. Remember, this pandemic did not start in January at the seafood market. We now know there was infections all the way back into September. This was a narrative that was decided that they were going to say this came from the wet market, and they were going to do everything they could to support it, to negate any discussion about the possibility that this came from a laboratory.
I got 20 seconds left. Dr. Fauci was affirmatively told in an email that NIAID had a monetary relationship with the Wuhan Institute through EcoHealth Alliance. He was told this in January 27th of 2020. Do you think that Dr. Fauci intentionally lied under oath to Senator Paul when he vehemently denied NIH's funding of gain-of-function research?
I think there's no doubt that NIH was funding gain-of-function research.
Is it likely that American tax dollars funded the gain-of-function research that created this virus?
I think it did, not only from NIH, but from the State Department, USAID, and from DOD.
I'm out of time. Thank you very much.
I now recognize the chairman of the full committee, Mr. Comer from Kentucky, for 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Redfield, I want to stick with you. You have said before that you were locked out of conversations about the lab leak by Dr. Fauci and Dr. Collins. Do you think they kept you out of the conversations because you believe COVID-19 may have come from a lab?
Yeah, I think I made it very clear in January to all of them why we had to aggressively pursue this, and I let them know as a virologist that I didn't see that this was anything like SARS or MERS because they never learned how to transmit human to human, that I felt this virus was too infectious for humans. There was a lot of evidence that lab actually published in 2014 that they put the H2 receptor into humanized mice so it could infect human tissue. I think, we had to really seriously go after the fact that it came from the lab, and they knew that that was how I was thinking, although I thought we had to go after both hypotheses. And I was told later, I didn't know I was excluded. I didn't know there was a February 1st conference call until the Freedom of Information came out with the emails, and I was quite upset as the CDC director that I was excluded from those discussions.
Why would they do this?
Because I had a different point of view, and I was told they made a decision that they would keep this confidential until they came up with a single narrative, which I will argue is antithetical to science. Science never selects a single narrative. We foster, as my colleague here just said, we foster debate. And we're confident that with debate, science will eventually get to the truth. This was an a priori decision that there's one point of view that we're going to put out there, and anyone who doesn't agree with it is going to be sidelined. And as I say, I was only the CDC director, and I was sidelined.
Well, I think Dr. Fauci and Dr. Collins got caught with their hand in the cookie jar. They got caught supercharging viruses in an unsecure Chinese lab. They wanted to push the envelope, and so they got together to cover themselves, cover up their story, and wipe their fingerprints of the virus that has killed more than 1 million Americans. To quote Jurassic Park, they were, quote, so preoccupied with whether or not they could, they didn't stop to think if they should, end quote. I look forward to the rest of the testimony today, and I look forward to the great work of this subcommittee. Mr. Chair, I yield back.
Thank you. I now recognize Ms. Lesko from Arizona for 5 minutes of questions.
My first question is for Dr. Redfield. A witness in our roundtable last week said that it was a no-brainer that the virus came from the Wuhan lab. When you were director of the CDC, did Dr. Fauci ever explain to you why he didn't believe the virus came from the Wuhan lab and why he actively worked to silence that theory?
Dr. Fauci's position, as those who thought of spillover, took the position that it was most likely a spillover event because that's what happened with SARS and that's what happened with MERS. Right? And I think it's important to look at, prior to 2012, we didn't really have another mechanism other than nature. We weren't doing gain-of-function research. Right? I'm a clinical virologist. I tried to explain to Dr. Fauci, who's an immunologist, that this virus, SARS and MERS, when they infected man from the intermediate host, civet cat in the case of SARS and a camel in the case of MERS, they never learned how to go human to human. So those original outbreaks were less than 1,000 people, and the epidemics died. And so when everyone thought this was SARS-like, well, it's going to die too. But this virus was immediately the most infectious virus, not the most, I think probably right behind measles, virus that we've ever seen infect man. So I immediately said, wait a second, this isn't natural. And then you go back and look at the literature and you find in 2014, this lab actually published a paper that they put the H2 receptor into humanized mice so it can infect human tissue. And then you learn that the new COVID, which came from bats, now can hardly replicate in bats.
Yeah.
So how does that happen? So I said that my view as a virologist, again, my hypothesis, and I never discredited them for their hypothesis, it's the spillover, was that this was most likely to come from the lab. And we need to aggressively investigate both hypotheses.
Thank you. Thank you very much. I have another question for you, Dr. Redfield. In a recent Energy and Commerce Oversight hearing, I asked the NIH acting director about the NIH's gross negligence in monitoring the EcoHealth Alliance grant and subgrant to the Wuhan Institute of Virology. He admitted that we might not have had all of the information and research reports from WIV and EcoHealth. He insisted, however, that he was sure that the coronavirus research at WIV was completely unrelated to SARS-CoV-2. With the information we know and the fact that China deleted data and asked NIH to delete data, do you believe that we can have certainty that the virus did not come from the Wuhan lab and that U.S. funding was not used for COVID-19 related research?
Yeah, absolutely, we can't do that. I will say, if you go back and look, it's declassified now, and I'm sure you all have your classified briefings, but the declassified information now, in September of 2019, 3 things happened in that lab. One is they deleted the sequences. It was highly irregular. So researchers don't usually like to do that. Second thing they did was they changed the command and control of the lab from the civilian control to the military control. Highly unusual, and I've been involved in dual-use labs when I was in the military. And the third things they did, which I think is really telling, is they let a contractor redo the ventilation system in that laboratory. So I think clearly there was strong evidence that there was a significant event that happened in that laboratory in September. It's now been declassified. You can read it. I'm sure there's more classified information around it.
Thank you. Dr. Redfield, the New York Post reported that you stated, I could use the word cover-up cover-up, but I don't know that, so I'm not going to speculate that. Do you believe there was a cover-up? And if so, why would federal agencies work with legacy media to silence scientists and other Americans asking questions about the origins of SARS-CoV-2?
Yeah, and I'm not a big fan of quoting the New York Post. I don't think I used the word cover-up. Okay, I think there was an attempt to misguide, redirect the debate, but I wouldn't have used the word cover-up.
Thank you very much, and I yield back.
Now recognize Ms. Green from Georgia for 5 minutes of questions.
If we're going to look into the origins of COVID and fully understand where this virus came from, this virus that has murdered so many people all over the world, I think the most important thing we can do today is look at the timeline. And if we go back to early 2020, when this was just starting to kill so many people, we'll see something interesting, that while Dr. Fauci, Dr. Anderson, Dr. Collins, Peter Daszak from EcoHealth, who, by the way, had a grant for gain-of-function research, Dr. Auchincloss and others were doing everything possible to shut down the Wuhan lab theory publicly, even though privately they told each other that COVID-19 looked engineered, and discussed the reason to stop the theory. And if they were to, it's really interesting. They wanted to give reasons for not expressing this opinion to the public were that it would do great potential harm to science and international harmony, and do unnecessary harm to science in general and science in China in particular, even though their paychecks are funded by the American taxpayers. At the same time this was going on, the CCP was using its full weight and power to spread a propaganda campaign to conceal the origins of COVID, numbers of cases and deaths, and protect their own reputations while stockpiling medical supplies, severely hurting the global supply chain and definitely hurting America. In the same way, the CCP silenced, censored, and imprisoned dissenters who tried to tell the truth. Dr. Fauci and his cohorts seemingly were running their own misinformation and ultimately censorship campaign to, in quotes from Dr. Collins to Dr. Fauci, put down this very destructive conspiracy about the lab leak theory. But it's really interesting. I think we should revisit January 27, 2020. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, finds out that they have a financial relationship with the Wuhan Institute of Virology through EcoHealth Alliance, and that they've been working with novel coronaviruses. January 31st, 2020, Dr. Fauci is warned by Dr. Christian Anderson that some of COVID-19's features potentially look engineered, and the genome is inconsistent with expectations from evolutionary theory. Dr. Redfield, did you agree, in your opinion, with Dr. Anderson's assessment at the time that this virus did look engineered?
I was concerned because of the presence of the furin cleavage site that we've talked about. And I think it's important to understand what that cleavage site does. That cleavage site totally changes the orientation of the binding domain of COVID. So it now, which could not see the ACE2 receptor, which is the human receptor, it totally changes the orientation now, so it has high affinity for a human receptor. So that furin cleavage site bothered me. It didn't seem that it belonged there. And then when you look at the sequences that it used, and it's beyond the committee, but I know many of you have looked into it, the sequences that they used in those 12 nucleotides for arginine were the arginine sequences, nucleotide triplet, that coded for the human arginine. So why did this virus have the arginine sequences for human there, not bat? It was very disconcerting to me. It looked like this virus was engineered.
Was this, what you're observing and speaking of, is this something that would be in line with gain-of-function research and the capabilities it would provide to a virus?
Yeah. I mean, basically, this lab published in 2014 that they accomplished in this, allowing the coronaviruses that they were working with in the lab to bind to the ACE2 receptor in humanized mice. And the only way they did that was by reorienting the binding domain.
And it was clear to them at this time that that was likely the issue in their private conversations. Yet by February 4th, a paper on the origins of COVID is drafted by 4 participants of the February 1 conference call. One of those participants, Dr. Anderson, completely reverses himself in an email to the president of EcoHealth, Peter Daszak, and says the main crackpot theories going around at the moment relate to this virus being somehow engineered, and that is demonstrably false. My question to you, Mr. Redfield, did you know of any evidence that they had found within 3 days from February 1st to February 4th to be able to confirm that it was not created in a lab?
As I mentioned earlier, unfortunately, I was excluded from those conversations, which I found retroactively very disappointed, since I was obviously a virologist and very engaged, and I actually had asked Jeremy Farrar, Tony Fauci, and Tedros to have these conversations. And then to be excluded, I found unusual. I do think it illustrates one point that's worth really focusing on. When you have a group of people that decide there could only be one point of view, that's problematic. And I'll keep going saying it's antithetical to science, and unfortunately that's what they did.
I can tell you, Dr. Redfield, that is the case. It's very problematic because how people suffered in this country from those, what I would call tyrannical decisions, using their positions of power and shutting down the country in the way they did. I think people definitely do feel that way. Thank you. I yield back.
I recognize Dr. Jackson from Texas for 5 minutes of questions.
We still have an issue with corrupt, politically driven advice, and this is evidenced by the misinformation regarding masks, natural immunity, the need for boosters, and most importantly, and most important to me at this particular time, the inappropriate efforts to vaccinate our children. So I would just say that we have to regain this trust in public health, and we have to do it quickly before something like this comes down the pike again, because American people right now have zero trust and confidence in the public health sector in this country. So I want to ask you real quickly, Dr. Metzel and Dr. Redfield, what do you think that we should and could do to regain that trust of our public health sector?
I think the first and foremost is we've got to tell the truth. When you don't tell the truth, you've got a problem. And I think if you go back, there were many times when public health officials packaged the message to what they wanted to say, but it wasn't necessarily truthful. The second thing, you have to have the courage when you're a public health official to say, I don't know, when you don't know. And I think that really fundamental, that's how we begin to lose it. When people say that we're going to be okay once we get 30% immunity, and then later they say 50%, and then later they say 70%, and then the press says, well, why did you say 50% before, and now you're saying 70%, and the guy says, well, I didn't think the public was ready to hear that. You've got to tell the truth.
I now recognize Mr. Jordan from Ohio for 5 minutes.
Thank you, Chairman. Look forward, the Democrats tell us. Focus on the future. Might have started in a lab, might have happened in nature. But here's the question I keep coming up with. If it may have been a lab, may have been nature, we're supposed to look forward, then why did Dr. Fauci work so hard for just one of those theories? Why was it so important to push one over the other? Dr. Barrett said, oh, we should entertain all hypotheses. Dr. Fauci had his hypothesis, how this started. We should entertain all of them. But that's not what happened. That is definitely not what happened. 3 years ago, if you thought it came from a lab, if you raised that, you were called a nut job. You got censored on Twitter. You were blacklisted on Twitter. You were even called a crackpot by the very scientist who in late January sent emails to Dr. Fauci and said it came from a lab. They called you crackpot. Is that right, Dr. Redfield?
I think the most upsetting thing to me was the Baltimore Sun calling me a racist because I said this came from a Wuhan lab.
Dr. Redfield, you ran the CDC and you were on the coronavirus task force. Is that right?
Correct.
That was formed on January 29th 2020. Is that right?
Correct.
2 days later, Dr. Fauci gets an email from Dr. Anderson which says what? Virus looks engineered, virus not consistent with evolutionary theory. Is that accurate?
That's my understanding.
Next day, I know, did he share that email with you, by the way, Dr. Redfield?
No.
As a member of the task force, as a head of CDC, did he share that email with you?
No.
Okay, next day, February 1st, Dr. Gary sends Dr. Fauci another email. That email says, I don't know how this happens in nature, but it would be easy to do in a lab. Did he share that email with you, Dr. Redfield? You didn't see either one of those emails, even though you're head of CDC, even though you're on the coronavirus task force that had been formed just 3 days earlier.
No.
3 days later, Dr. Anderson and Dr. Gary, who told us it came from a lab in emails to Dr. Fauci that Dr. Fauci wouldn't let Dr. Redfield see, 3 days later, they changed their position 180 degrees. The question is why?